Hey everybody, welcome to Pick Dr. Osborne's Brain. We've got a great live Q&A for you today. For those of you who are new to the show, the way it works, if you've got nutritional questions, type them into the chat box or feed. If you've got questions about autoimmune disease specifically, that's what we're going to be covering today as we did a major crash course on Tuesday. If you missed that show, make sure you go back and check it out. That was Tuesday at 6 p.m. So we'll dive into your questions. Let's see, Ange, my total tox test showed high levels of mycotoxins and metals. I know this can be a cause of Hashimoto's. Do I need to address the mold or metals first? It depends, Ange. If you're referring to mycotoxins, you got to get the heck out of the mold. You're not going to recover or improve much if you're being exposed to poisonous air contaminated with mycotoxins. So metals are, depending on the metals, depending on the severity, metals can be a big deal too, especially with Hashimoto's. Lead, mercury, cadmium, aluminum are all potential inflammatory triggers. So I would say depending on the levels of your metals and whether or not you're currently getting ongoing exposure. But in my experience, typically mycotoxins are much more of a threat and need to be dealt with first, because you're never going to recover from autoimmunity if you're breathing in poisonous air. Okay, let's see here. So let's see. Hi, Dr. Osborne. Wanted to thank you for sharing your knowledge. I have celiac disease, completely grain-free and lactose-free. Take enough vitamin B complex, magnesium, and D3, and still feel irritation and even, I guess, maybe anxiety. Any thoughts about this? You need to get tested. You're doing a lot of great things, a lot of the right things with your diet change. But if you're still struggling with persistent symptoms, one of the things that I would highly encourage any of you to do is get tested for vitamin and mineral deficiencies. Vitamin and mineral deficiencies are a major contributing factor to persistent symptoms, especially with those with celiac disease, simply because celiac is damage to the small intestine that causes long-term, it causes malnutrition. And even if you change your diet, research shows, in my clinic practice, we see the same thing, but it shows that you may not cover those nutritional deficits even after changing your diet. In other words, deficiencies can be persistent and linger. So I would strongly encourage you to get nutrition testing done. I'll put a link to that type of testing because many of you have come back to me and said, my doctor won't do it. So here you go. I'm going to put that link in the feed for you, and then you can get that, read more about how to get the right kind of testing done nutritionally. I would say this too. I'm sorry, I was just reading another comment. I would say this, that many of you that are relying on hair testing for vitamin and mineral status, it's a very poor indicator of current need. Hair is not a great way to measure nutritional status. Yeah, there's some benefits to using hair for some things, but if you're trying to really get accurate and trying to really get dialed in, you have to have some intracellular testing done. Serum tests, hair tests, not so great. Let's see. Hannah's asking, hi, Dr. O, follow-up question. I have 5 nanograms per milliliter ferritin level. That's extremely low, Hannah, by the way. Most labs would mark that as an urgent red flag. Healthy level, if you're a menstruating female, is going to be 75 or higher. And at 5, you're pretty much, your iron stores are shot. So you really want to talk to your doctor and get that thing up above 75. Remember, every time, if you're of a menstruation age, every time you have a cycle, you're losing iron. through blood loss. And if your levels of ferritin are hovering around 11, every time you have a cycle, you're going to go into transient iron deficiency anemia. So you're going to cycle 2 months out of the two weeks out of the month. You're going to have this anemia that just persists and doesn't really ever go away. So you got to get that up. And, you know, you can do that through iron-rich foods like meat and liver. You can also do that through supplementation. But if you don't know whether or not you have a gluten issue, if your diet is, you're not gluten or if you're not gluten-free, understand that one of the most common causes of iron deficiency is gluten. It's because gluten can damage the areas of the stomach and intestine that help you absorb iron. Okay. Thoughts on L-reuteri and SIBO yogurt? I think L-reuteri is great if you want to use it as a type of probiotic. And Dr. William Davis, who's on our board of advisors at Gluten-Free Society, a brilliant man. Actually, I think we've got him coming on the show here in the next few weeks. And we've done interviews as well about L-reuteri. You can check those out at Gluten-Free Society. If you look at under our board of advisors, we have interviews there with him. But I think it's a good probiotic to have. I think it's very much missing and lacking for many people today as a result of the loss of diversity of the microorganisms they're supposed to inhabit your gut. But I will caution about it being a cure-all. Not to say that that's at all what Dr. Davis is saying. But many people sometimes take things out of context or blow them up, especially those that are out there that are just trying to sell product and don't know enough. It's a great probiotic, but it's so much deeper than just taking L-reuteri to fix SIBO. Should I take spore-based probiotics during or after fluconazole round? Don't know. I mean, if you've got a doctor prescribing you fluconazole, talk to your doctor about it. You know, if you've got a fungal infection or a yeast overgrowth, I would imagine that's the case. Fluconazole is an antifungal. Hard to say. Let's see. I had to have my teeth repaired. There was wear chipping on the back of the incisors. Dentist says it's not due to autoimmune condition. I have a history of celiac and dermatitis herpetiformis. What's your opinion on that? Well, I mean, there's a lot of things that can chip teeth or wear teeth. You could have an underbite, rather an overbite, and that could lead to damage on the back of those teeth. So, I mean, there's a lot to that. I would say this. We know that gluten can cause autoimmune reactions against teeth enamel, and that can lead to increased risk of caries or cavities. We know that gluten can cause changes or alterations in the microbiome that affect your mouth. And so that we know can cause malnutrition that can lead to deterioration of the gum line and periodontal disease. So there are definitely some connections between oral health and celiac disease and gluten. But chipping may or may not be that. I mean, I would look at if you have an underformed jawline, meaning if your lower jaw is not protruded adequately enough, then your bite changes. And then if your teeth in your bite aren't correct connecting properly, you can chip away at teeth as well. So I mean, a dentist can give you a better indicator of whether that's happening. What some people are finding with poor bites is the use of nasal breathing. A lot of people are mouth breathers. So when you go to bed at night, if you're breathing out of your mouth, that's going to affect the structure of your skull. It's going to affect the shape and the structure of your jawline, and it can actually lead to a receding jawline. So some people are finding that mouth taping is an extremely beneficial thing to kind of help restructure the face over time to improve dentition. Again, these are things you can look into, but really talk to your dentist. And if your dentist is more of a traditional dentist, you might look for a biological dentist. There's a great website for that. IAOMT.org is a great organization that trains dentists to be kind of more along the lines of natural dentistry as opposed to surgery for everything. It's always a good idea to get a good opinion. Sarah says, thank you, Dr. Osborne. Your advice got me an appointment at Sheffield with the gluten ataxia clinic. No neurologist in my area had heard of the information you gave me. You've taught me so much. I'm very, very glad you were able to get an expert on your side, Sarah. Gluten-induced ataxia, for those of you who struggle with ataxia or dizziness or loss of balance or vertigo, and you've not been tested for gluten sensitivity, follow Sarah's lead. Gluten sensitivity can cause damage to your brain, leading to ataxia. So anyone with ataxia should have gluten-induced ataxia ruled out. Ideally, the best way to do that is genetic testing. The genetic markers for gluten sensitivity and non-celiac gluten sensitivity, very important delineation there. The markers for celiac disease genetically are what are called HLA-DQ2 and HLA-DQ8 markers. Unfortunately, that's where most doctors stop their investigation. But the researchers in the UK, this is Dr. Marius Hajivaslu and his group at Oxford, have found that HLA-DQ1, which is what's referred to as a non-celiac gluten-sensitive marker, is much more prevalent in people that struggle with gluten ataxia. And I've written a number of pieces on that and alluded to that research group's work on Gluten-Free Society. If you want to read more about it, you can go there. But definitely you want to get the full spectrum of genetic testing done if you're looking, because a lot of doctors will only measure the celiac markers and they will not measure the non-celiac gluten sensitivity markers or NCGS markers, and those are important to get. Those of you who are looking for that, if you're running against a brick wall with your doctor, I'll put a link into the chat here for you, and you can read more about genetic testing and make sure you get the right things done. Okay, let's see here. What's the best way to reverse autoimmune thyroiditis with high TPO antibodies if already following a gluten-free diet? Monica, one of the most important things you should be doing is following a grain-free diet, a true gluten-free diet. A gluten-free diet is wheat, barley, and rye-free. A true gluten-free diet is wheat, barley, rye, oats, corn, rice, sorghum, millet, teff, triticale, buckwheat, amaranth, and quinoa-free. And this is where so many people fail in their diet. As a matter of fact, I wrote my book, you can see it here behind me, No Grain, No Pain, because of this. We were finding so many people who were following gluten-free diets, failing to recover, failing to respond to their diet changes effectively. Some would improve, but then they would plateau or they'd have persistent problems. And this is what ultimately originally led me to doing, over a decade of research on the anatomy of gluten in plants, right? So if we define what gluten actually is, it's not just the protein found in wheat, barley, and rye, but it's actually the storage protein found in the seeds of grass, which is all grasses, right? Wheat, barley, rye, oats, corn, rice, sorghum, etc. And many people react to these other forms of gluten, but the food definitions and the labeling laws don't include those other types of glutens. And so unfortunately, this is to the detriment of many who are trying to adhere to a gluten-free diet and get better and not getting better. So if you haven't, read my book, No Grain, No Pain. It defines all of these things, maps it out for you so that you can recover. And if that doesn't work, come back to the show and we can brainstorm some more ideas out your way. Patty says, any AI disease that has symptoms of generalized itch all over the body, not just in the areas of my psoriasis and not only in the Sjogren's dry eyes. Remy and GP docs are stumped. So you probably have a histamine problem, Patty. If you have itching all over, your body's probably overproducing histamine. Histamine is the chemical released by white blood cells that can cause that generalized itching. It can cause other symptoms as well. If you haven't checked out my crash course on histamines, I highly encourage that you do that. We can put a link in for you. Let's see here. But histamine is one of the more common triggers of whole body itching. And so what we see a lot of times is that people with elevated histamine levels, just persistently, despite having a great diet, is they have a problem with mold in their environment. It's a very, very common connection. I just put a link in, Patty, for you on histamine. Okay, let's see here. Can prolotherapy be helpful for cervical neck instability? It's possible. It depends on why you have cervical neck instability. Eric, if you have an instability, you want to talk to the doctor who diagnosed that and get definitive on why the instability exists. Because a lot of cervical instabilities, if it's not an autoimmune process, I mean, there's certain cases of rheumatoid arthritis where you can develop cervical instability at C1, C2 because of the active autoimmune process that erodes away the ligament that stabilizes C1 and C2. But otherwise, so you want to get, my point is you want to get clarity as to why you have the instability. And then I can give you a better answer about whether or not prolotherapy might be helpful. Prolotherapy can be very helpful for a lot of folks for a lot of reasons, that just depends on what's causing or driving your instability. Antibiotics in general, bad, but is rifaximin coupled with probiotics safe? I think it just depends on your situation. I mean, this is where you and your doctor should be having a sit-down conversation about what's best for you, and talk about the risks of using a drug like rifaximin, and talk about the potential benefits if you're trying to treat SIBO. I would imagine that's what you're referring to. Rifaximin commonly used to treat SIBO. Is sucrose, cane sugar, okay, or is it more like an artificial sugar? Well, it's not healthy. Cane sugar is bad for us. It's just not good. And part of that, you probably could get away with it occasionally, but if it's regularly a part of your staple diet, you're gonna struggle. Sugar is an empty calorie. Cane sugar is empty calories. That means it provides energy without vitamins or minerals, which means in order for your body to utilize the cane sugar and process it, you have to steal nutrients from your storage to process every calorie of cane sugar that you're consuming. And that's true for any other empty calorie as well. Alcohol's empty calories. Any processed sugar product, whether it's from cane or whether it's from corn or beet, doesn't matter. They're all empty calories, and they're all very, very bad for you. Let's see here. Very thankful to you, Dr. O, to your family and your staff for all you do, for all your willingness to share with us. That helps us all become healthier people. Wishing you happy holidays. Thank you, Dia. I appreciate that. Wishing you happy holidays as well. And I'll just go ahead and say Merry Christmas. We celebrate Christmas. If you do, great. If you don't, that's great too. Is MCS, multiple chemical sensitivity, the same as autoimmune? It's a type of autoimmune. Multiple chemical sensitivity, what that really means, it's a broad term that doctors use to say your body is reacting to all the exposures environmentally that you have. This is generally because your immune system is overwhelmed and it's shooting first, and it's not recognizing good from bad, which is what autoimmune is. So MCS is a form, I would argue, a form of autoimmunity. And as a general rule of thumb, when we're trying to eradicate autoimmunity, we have to control the triggers. The triggers are typically food-based triggers, chemical-based triggers, microbial-based triggers, and nutritional deficit triggers. So definitely have to look at those. I recommend anyone with any form of autoimmunity, including MCS, has a good doctor that can measure those triggers and help them on the right path. Is there a link with dermatographia and autoimmune disease? Yes. Dermatographia a lot of times is a histamine issue as well. So just like histamines can cause itching of the skin. They can also cause, so those of you who don't know what dermatographia is, it's a condition where light pressure across the skin causes eruptions of aggressive red patches. And again, that can be histamine related, which, as I mentioned earlier, histamine commonly comes out to play when you have a heavy mold exposure. But gluten can also do it as well. So there's definitely a connection with both, and it is in the family of autoimmunity. Is it okay to take berberine together with apple vinegar, or is it better to do just one? And you're talking about to suppress blood sugar spikes. The best way to suppress blood sugar spikes is not to take berberine or apple cider vinegar. It's to exercise and control your diet around things that cause spikes. I mean, you certainly can use berberine. I like using berberine as a means to help, at least initially. But if you're hitting all the right notes in your diet and lifestyle, you shouldn't need to take berberine for the rest of your life to control blood sugar, nor should you need to take apple cider vinegar. But if I were choosing between the two as far as effectiveness, I would choose berberine. How would you deal with someone with ALS? Jim, tough one. ALS is tough. In my experience, I lost a stepfather. My stepfather died from ALS. This was before I went to school and got educated about health. But in his case, he was a metal worker, and he was highly exposed to metal fragments in his work environment, and most likely acquired it as a result of that lifelong exposure. But ALS has multiple triggers. Probably the one that I have seen trigger more ALS than anything else, beyond gluten, is mold. Mycotoxin poisoning of the central nervous system can damage the brain and nervous system, contributing to ALS and other autoimmune neurological diseases. So if you haven't looked into that, I would highly recommend that you do that. Get with a good doctor who can do the right testing to help you identify the potential triggers. But if you're asking me how I would deal with it, I would look at the triggers. I would look for the triggers, 4 categories: food, chemicals, microbes, and nutritional deficits, because that's what is going to be at the base of driving those. What's the best way to reverse? I think I answered that one already. Good evening. Oh, good evening. You must be on the other side of the pond, Sandra. My husband has multiple sclerosis and keeps cold all year long. Is there anything that I can do to help him? Well, if he's got MS, he should definitely have his vitamin D and his vitamin B12 levels checked, because there are some types of MS that are actually vitamin D and B12 deficiency in disguise. And I have seen tremendous benefit in patients over the years just with those two things. So if you're looking for kind of simple things to look at for him, I would definitely look at those two. Beyond that, gluten-free diet, grain-free diet. Probably one of the biggest causes or triggers of MS is gluten, in my experience. So I definitely would consider getting him looked at in that regard as well, as good places to start. Maybe gift him a copy of No Grain, No Pain for Christmas. But the thing about helping other adult people that you love, sometimes you want to do something for them around their diet and lifestyle that they don't want to do. Right. A lot of people out there like this. They don't want to change their diet. They don't want to improve their health through the things you're recommending. And so that can be a tough situation where, that it might help them, but they're not willing to do it. So, I don't know how your husband is, Sandra, but I would just say keep that in mind too, because you can really get frustrated and really lose hope when that happens, and it can take you down through stress. So you have to also preserve your own integrity by respecting that other people have the right to make their own decisions about their own health. Even if you think they're doing it wrong, you still have to respect that, and you can't let the stress of that derail you and your health. It's a tough situation to be in. Let's see here. My doctor says I have metabolic disease. Is that an autoimmune disease or does it cause autoimmune disease? Be more specific, maybe, Alice. Metabolic disease, if you're referring to metabolic syndrome, which is kind of a combination of high blood sugar, high blood pressure, obesity. There are some people now seeing there's an autoimmune process that's driving the inflammation behind that. But there are certainly things that you can do, whether it's autoimmune or whether it's not. Number one is eat real food. Quit eating processed food. There's a study just came out. There's lots of new research coming out on this, but a more recent one showed women eating ultra-processed food and their babies had much higher levels of mycotoxin concentrations in their body. Mycotoxins can drive metabolic inflammation. We know about gluten. We know about some of the other chemicals and food additives and food preservatives that are drivers of the autoimmune and the metabolic inflammatory processes. So just by removing the chemicals from your food, you're light years ahead of the average person out there who doesn't even recognize that there are chemicals in food. But again, depending on what specific diagnosis your doctor gave you, Alice, it's hard to say. If it's metabolic syndrome, though, it's 100% reversible with diet and lifestyle change. No matter what anyone else tells you, it's 100% reversible. Is hypothyroid an autoimmune disease? It can be. You can have autoimmune hypothyroidism. That's called Hashimoto's. You can also have hypothyroidism that's nutritionally related, meaning you could have hypothyroidism because of an iodine deficiency or a selenium deficiency or a vitamin B2 deficiency or a tyrosine deficiency. There are about 17 nutrients that are required for your body to be able to properly produce thyroid hormone and to regulate thyroid hormone. I did a crash course on that. If you haven't watched it, I highly encourage you check that one out, Gene, because there's a ton of phenomenal information that you'll probably you won't get it anywhere else, for sure. I feel very confident about that. If you have some soft plaque buildup in the coronary artery, what diet or protocol do you recommend? I mean, you can test for TMAO, but Andre, I would say, if you're looking for a dietary protocol, you got to make sure that you check your nutrition status. I mean, there's not like a magic bullet diet that's going to reverse all plaque. You start with not eating things that cause inflammation because plaques are formed in an effort to patch inflammatory damage inside the artery, inside the endothelial lining of the artery. So if your diet is inflammatory, you're going to form plaques. That being said, your diet has to be non-inflammatory, but that's unique for the person. Some people, one man's food is another man's poison. That's the saying goes. And so you could, I've had cases, people reacting to broccoli and cauliflower and chicken and blueberries, all healthy foods. But, again, depending on the person. So you got to make sure you have an anti-inflammatory diet. That's the best protocol against any kind of inflammatory disease, is to not eat things that cause inflammation. I mean, there are other things you can do to support healthy vasculature, vitamin C and niacin, vitamin B3, proteolytic enzymes can be an ally in this regard as well. So, I mean, there are a number of different things that can be done, but ultimately, if you're dealing with something like that, it could potentially get worse and become, possibly life-threatening. Test, don't guess. And that's my advice for any of you, who are trying this at home. I know the frustration for a lot of you is you go to your doctor, you talk to your doctor about, hey, what can I do? And your doctor dismisses the conversation and says, take the medicine. And you're trying to find a lifestyle or diet accommodation that is going to help your body be healthy. And they're not trained in that, so they ignore it and they won't test it and they won't help you test it. And they're not trained in it. And so, the world has fastly become very disgruntled about healthcare because healthcare, frankly, sucks. You're not sick because you have a deficiency in fill in the blank drug or medication. You're sick for a variety of reasons that have much to do with your diet and lifestyle choices. But we have an arsenal and an army of hundreds of thousands of doctors who have no training in that, so they don't know what to do. And so if you go to them, it's kind of an impasse. So, I know that doesn't help you immediately, but I would just argue or encourage you rather to find somebody, a good functional medicine style doctor who's willing to have that conversation. Because at the end of the day, if your doctor's not willing to have the conversation, then the only answers that they're going to have for you are drugs and surgery. And if you follow me for any length of time, you know that drugs aren't the answer, and you know that surgery is typically not the answer, and that there are complications with both. And at the end of the day, if you're trying to improve your longevity and your quality of life, you're not going to find that in passive therapies. You're going to find that in active things that you should be doing. And sometimes it's simple things, and sometimes it's more complex, and getting the right kinds of testing done by doctors knowledgeable in the biochemistry of the right testing is very important. And it's the step forward that you need to make. Is psoriatic arthritis in my finger joints considered autoimmune? Yes, psoriatic arthritis is absolutely, without a doubt, 100% an autoimmune process. Read No Grain, No Pain, and that's the first step. Read No Grain, No Pain, start following the diet, come back in a couple of months and let us know what your joint pain is doing. Let's see here. I have burning mouth syndrome. Could that be an autoimmune disease? Burning mouth can be. Burning mouth, I've seen burning mouth. The two most common things that cause burning mouth syndrome are mold exposure, mycotoxin exposure, and mercury. So have those two for sure looked at. You can have burning mouth syndrome as well for B vitamin deficiencies. So, those are all just simple things you can have measured or tested and rule out. Is psoriatic, let's see, I answered that one. A mystery. Young patient has a history of lead and mold exposure since birth to a year old. Now, a few years later, we are out of the situation, but she is allergic to 40 foods. What do you do? See somebody who knows how to take care of her. One, there's not enough context in that short blip. And two, your assumptions about being out of mold may be wrong. I see that all the time. Most people that think they get out of mold, many of them don't, and it persists. But if she's got a history of lead exposure, was she chelated? If she's got a history of mold exposure, was she detoxified? Did you get a detoxification protocol from a good doctor to help pull those toxins out of her? Because mycotoxins can get trapped and enterohepatically trapped in people and can create persistent issues. But if she's allergic to 40 foods, and you're talking IgE allergy, IgE being a specific type of allergy test, then you're probably not out of mold. You don't typically we don't see people allergic to 40 foods unless they're in mold, where they have some type of mast cell activation or some type of major environmental contaminant exposure that's driving their immune system crazy and causing it to react to the food that they're eating. So there's a lot to unpack there. Hopefully that was helpful for you. What would cause high iron level at 158? That's not super high. 158 is not a super high iron, so I wouldn't be too concerned about it. I'd monitor it. Same thing with your hematocrit. 48.3 is not astronomically high. I would monitor your iron. Sometimes you can have a high iron and hematocrit on a blood test because of dehydration. There's another situation where you can have a genetic disease called hemochromatosis. So you might talk to your doctor about running the appropriate testing to rule that out. Yeah, so an extension on that, there were many questions on the child with lead and mold exposure. If you think about going back to the GAPS diet, I mean, that's a great place to start. I would say I've never seen anybody with a history of mold exposure be able to recover from their mold exposure without being on a grain-free diet. That's 23 years, really a little more, 24 years of practice. Um, thousands of cases. I just, what mold it's one of those that we call it a gluten accelerator, right? When you're in mold and the damage that mold causes contributes to such microbial imbalance in the gut and damage to the gut lining that people are reacting to grain. And remember too that grain is the food group that has the highest concentration of mycotoxins. This is another reason why people that have a history of mold don't recover if they get out of the mold and they're still trying to eat cereal and bread and pasta and other grain-based products, because you're still being exposed to mycotoxins and your immune system is primed to react to mycotoxins because you've been in mold. And you've got to get out of that mold for an extensive period of time, 18 months, to calm that immune system down. So I mean, I would look at, if you're considering that GAPS diet, GAPS is pretty grain-free as far as a diet is concerned. But in my experience, sometimes GAPS is it's not necessary, but grain-free absolutely is. I have nickel in my crowns. I'm allergic to nickel. Should I have my crowns replaced? Depends. I mean, talk to your dentist. How aggressive would it be for him to replace those crowns? How easy would that be? But if you're allergic to nickel and you're having a lot of allergic symptoms, yes, you probably should have them replaced. But again, I would talk to your dentist and do a risk benefit analysis conversation with him about what he thinks you should do. Having an allergy such as hay fever, is it part of having an autoimmune disease? Not necessarily. You can have hay fever. You can be allergic to environmental plant chemicals. That's very common. I mean, for example, hey, there's hay fever, and then you got ragweed allergies, then cedar fever, and some people are allergic to mold. So I mean, it's definitely possible to have allergies without having autoimmune disease, but it's also possible to have both. I'm positive on an ANA test. They think it's autoimmune hepatitis because I had high liver enzymes at the same time, but normal on the ultrasound and normal FibroScan. You need to change your diet. That would be my advice. If you've already got if you've got elevation of liver enzymes. Now, first of all, let's back up just a minute. If you've got a positive ANA, let's talk about what that means. There's a really great group of researchers at the VA hospital, led by a Dr. Arbuckle, that were doing studies on blood samples that were given from soldiers in prior years. So they were actually, it's like going back in time. They went back, grabbed these frozen blood samples, measured them for ANA, anti-nuclear antibodies, and any of the samples that came back positive, they then proceeded to call that soldier who gave that blood 5 or 10 years ago and ask them, did you go on to develop autoimmune disease? The answer was 93% yes, meaning that positive ANA has if we look at those studies, positive ANA, there's a 93% predictability that you're going to go on to develop autoimmune disease. Okay, so that being said, is your liver enzyme elevation part of that? Don't know, because there are other things that can cause liver enzyme elevation beyond autoimmunity. I mean, alcohol. You may have aggressively exercised the morning of your blood work and got a false liver enzyme elevation. That's a possibility. So again, there's nuance to interpreting a lab test based on the parameters around how the lab test was taken. And so I would have that conversation with your doctor, but it's also possible they're right that your ANA is contributing to liver damage that has not yet manifested on scans as fatty liver or liver cirrhosis. It takes time to develop, and the liver's a quick healer. So sometimes the damage can go on for 10 or 15 years before a scan can actually show up positive. So scans are not definitive. They can be useful, but they're definitely not definitive. Will vitamin B1 stop or help with internal tremors from tachycardia or POTS? Maybe. You can try it out and see. Rico, I would say vitamin B12, if you've got POTS, I would look at vitamin B12 as well as a potential. There's a lot of correlation and connection between gluten, vitamin B12 deficiency, and the onset of the development of POTS. So I wouldn't leave B12 out of that equation. You might also look at your calcium and magnesium, because a lot of tachycardic folks have magnesium and calcium deficiencies, and so that might be contributory as well. How does the SNP VDR-TAQ fit in with autoimmune gastritis? It doesn't. I mean, not really. I think the SNP testing is so overrated. I have a lot to say about this because this was probably 20 years ago. I actually helped to develop one of the first SNP tests that became available direct to consumer. I worked with a lab in Colorado, and for 5 or so years, we used SNP testing in clinical practice to see what kinds of outcomes, how effective it was. Those of you that don't know SNP, SNP, that's single nucleotide polymorphism. These are tests that measure genetic variants in people that might have an indicator that that person has a faster or slower gene or has a greater need for a certain vitamin or mineral. And all of this was really originally based on the work of a brilliant doctor by the name of Bruce Ames. And what we found clinically was that SNPs, whether you had them or whether you didn't make or break the outcome. What made or break the outcome in health was diet and lifestyle change, period. SNPs didn't matter. I could have somebody with a positive SNP or a negative SNP. Didn't matter. If I try to give them vitamin D in this case as an example, or if it's an MTHFR mutation, you try to give them folate. It didn't affect their outcome unless you cleaned up their diet and cleaned up their environment. Now, if you did those things, most people recovered regardless of their SNP. So I'm of the opinion that a lot of people put way too much weight on genetic SNPs and not enough weight on behavior modification and diet modification. I think if you've done behavior and diet modification already, now SNPs may have some value and benefit for some tweaking. But if you haven't done the first part, the SNP is, in my opinion, is extremely irrelevant in terms of your overall outcome. What should I do or take if I'm losing weight and have done all the tests and they cannot find anything wrong? I don't know what all the tests mean. You know, people tell me, they come to me all the time and say, I've had all the tests, and they haven't had, I mean, they've had mediocre workups at best. So, without knowing explicitly all the tests and what you mean by all the tests, I would argue that you haven't had all the tests, but you're under the perception that you have. So that being said, if you're losing weight, I mean, the first things first, are you eating enough calories? Because if you're not eating enough total calories, you're going to keep losing weight. I mean, so you start with your basic metabolic rate and go from there. There are BMR calculators you can find online that will help you assess how many calories a day you should be eating, and start there. And if you're under that mark, you're not going to gain weight. Beyond that, again, I would just go back to, you haven't had all the tests. There's something going on there if you're adequately caloried. And so a lot of people that are losing weight, it's because they're eating foods they're allergic to or sensitive to. And so the food, instead of nourishing them, is a source of poison, driving and causing inflammation, which is creating more work for their body to do to heal and repair from the food that they're eating that's damaging them. I see this all the time in kids who aren't growing or have been diagnosed with failure to thrive by their pediatrician. And the advice is always, eat ice cream, eat a candy bar, drink sodas, eat more calories. And what that leads to is such a level of inflammation that the kid continues to deteriorate until we actually put real food in the kid. And that's when nourishment can happen. Real food, real calories that a person's not sensitive or allergic to. So I'd say those would be two real simple places to start. What do you think about MS? A lot. I mean, you got to get more specific with your question, I would say. I mean, MS is an autoimmune condition. It's treatable. I've seen people get out of their wheelchairs and walk again. I've seen people do extremely well and regain their motor coordinative strength and function. You can, if you want to, we've got there's a couple of cases, I think, of MS that we've actually videoed in our testimonial playlist on our YouTube channel, on Dr. Peter Osborne YouTube channel. And so you might want to check those out. But lots of thoughts on MS. It's specifically, if you've got a more specific question, you can ask it. A lot of plaque psoriasis on my neck and head and around my nose, and may have irritable bowel. I went on a keto for 6 months and saw no difference. It's more of a comment. You're missing something, Bob. You're missing something. Keto is a high-fat, low-carb diet, but it is not a gluten-free diet. Most of the keto I don't know if you're doing this, Bob. I don't want to accuse you of it if you're not. But a lot of people, when they go keto, they buy the shit. Excuse my language. They buy the horrible for you keto junk food snacks, right? The easy, kind of processed. A lot of that stuff's made with corn fiber, and corn is a major contributor to psoriasis. So I'm just throwing that out there. Maybe you're not doing that, but if you are, it's something to think about. Because keto is not a grain-free diet. And if you've got an autoimmune condition and you're not grain-free, you can be keto but not grain-free. And remember, it only takes 20 parts per million of gluten to cause an inflammatory response that can last several months. Thoughts on raw milk benefits resolving many conditions? I think it just depends on the person, Sarah. There are people that are that have amazing turnarounds using a raw A2 milk or milk byproduct like colostrum. And these things can be very powerful food agents. Now, provided you're not allergic to dairy, provided you don't have lactose intolerance, so there's nuance to that. I'm not opposed to dairy. I'm opposed to the way dairy is being produced in most industrial countries, right? From cows being fed GMO grains. The GMO grains are double sprayed with poisons like glyphosate. And so that stuff's showing up in the milk, and then we're drinking the milk, and it's not healthy milk, right? Or the cows are eating the wrong food. The cows are eating food it's not what cows are supposed to eat. And so then the health of the milk and the fat and the type of omega-3 concentration and the vitamin E concentration and the vitamin A and the CLA concentration of the dairy is almost non-existent when you feed cows garbage food. And you remember the cow's milk is only as healthy as the cow's diet, the cow's environment. So we're talking about raw, and you can take raw milk from a sick cow. So raw milk has a kind of a delineation in the marketing realm of something that's inherently healthy, but you always have to consider the source and what the source was fed and how the source was taken care of. So a lot to unpack there. I've done a couple of pretty lengthy shows, Sarah, on dairy. If you want to do a deeper dive on that, and I would encourage you to look those up on the YouTube channel and check them out. How do I lower my triglycerides? It's at 78. My total cholesterol is 324. If your total triglycerides are 78, you really don't need to lower them more. I mean, triglycerides below, ideally, I like to see people's triglycerides below 75. So you're a couple points above that 75. But, the number one way to lower triglycerides is reducing carbohydrate intake in your diet and exercise. If you're doing those two things consistently, your triglycerides will fall. I mean, I find that, if I maintain my diet and my exercise, triglycerides stay in the 40s. But if I have a few weeks where I'm slacking off a little bit, they'll start to creep up. So you definitely, it's those two things, exercise and carb consumption, are going to be critical. Is there a typical autoimmune disease linked to seeping of the ears? It seems to be one of the symptoms no one has. You're in mold. I would argue you're in mold. If your ears are seeping repetitively, that's a symptom that I see very frequently in people who are living in a moldy environment and being poisoned by mycotoxins. I went on 3-day fast for a couple times, had no problems. Then the third or fourth time, I lost about half my muscle mass. You can overdo fasting. everybody's out there talking about fast this and fast that. And, there's a ramification to fasting. I mean, if you're trying to get stem cell production and healing and repair, 3 days is enough. If you go too far with it, what ultimately is going to happen is you're going to become malnourished during your fast. And if you're using it to heal, you're not going to heal when you're malnourished. And that's the fundamental flaw of fasting, the way I've seen it play out. Now, if you're a female and you're under a tremendous amount of stress, fasting's a bad idea. You've got to get your blood sugar better controlled and your inflammation better controlled before I would really highly encourage a fast. Fasting is a tool that healthy people can do to stay healthier. And it's a tool that many sick people can use to kind of jumpstart some relief. But if you overdo it, you're basically malnourishing yourself. I've seen many people damage their nutrition status through aggressive or over aggressive fasting. It's not to say it's dangerous, but you can overdo it. Dexamethasone is the only thing that helps me. That means you're inflamed, Kathy, and you need to figure out what your triggers are. It's either food, chemicals, microbes, or nutritional deficiencies, or a combination of things in those 4 categories. You need to work with somebody who knows how to test you properly so that you can make the proper adjustments. Because if you're having to use dexamethasone to basically to appease your symptoms, that's a losing streak. Even though it helps you, any long-term use of steroid causes bone loss, muscle loss, fat gain, elevations in blood pressure, cortical atrophy, cortex atrophy of the adrenal glands. I mean, it's just not a good scenario to go down that path for long periods of time. Would excessive mold toxicity explain a sudden increase in the effects of alcohol? Yeah, absolutely. So too could, Michael, a yeast overgrowth in your intestine. Yeast overgrowths in the intestine will convert any yeast. Remember, how do we ferment? How do we make alcohol? We take yeast and grapes. That's how we make wine. We take yeast and wheat. That's how we make beer. So if you're dealing with if you're a cheap drunk situation where alcohol really wrecks you, or maybe it used to not, you might have a yeast overgrowth in your gut and you're making alcohol all the time. So when you try to drink alcohol as well, the burden becomes overwhelming. But yes, excessive mold toxicity, mold in your environment or mycotoxin exposure, because those things damage your liver, and your liver is necessary to process that alcohol. So you could become more susceptible to alcohol poisoning as a result of mold exposure. There's a lot of you today are asking about mold. And so I'm going to, we're working on the largest mold project ever done. For those of you who are your diet's dialed in, maybe you're already following the no grain, no pain protocol and you're still struggling. But I would recommend that any of you that suspect mold or want to learn more about mold, check out, I just put a link up in the feed for you, moldjack.com, the biggest project on mold ever done. And we've filmed probably 50 hours of footage so far. And I've got another 40 to 50 hours of filming. But we're actually, we're going to be launching this in the next year for all of you struggling with mold so that you can find real answers and get the help that you need. But mold is a major problem with autoimmunity. And we're in the middle of an epidemic of mold toxicity now. 50% of the homes are estimated to have mold, either because of poor construction or because of aging infrastructure. And so people, it's the toxicity. It's the thing that people don't see. They don't know it's there, or they want to ignore it because the thought of thinking, what do I do if I have mold in my house, becomes paralyzing. I know I've lost a house to mold. That's why we're doing it. Those of you who know my story have heard me talk about mold. It's tough. It's one of the toughest things to deal with, and it's epidemic. But go check out Mold Jacked and make sure you're on that list, because we're going to be having updates all year about how to get help for mold. Because so many doctors don't understand it or don't so many doctors just dismiss it, very much like they dismiss diet and nutrition. What are your thoughts on reducing thyroid antibodies associated with Graves? Yeah, see it all the time in people, and one of the best things you can do is go grain-free. I see antibodies in people with Graves' disease going away on grain-free diets. So, I mean, there may be other factors too, but that's a real simple one to start first. How can I be told if I am HLA-DQ2 positive? If you're trying to figure out whether or not you have a positive HLA-DQ for gluten sensitivity or celiac, I put a link, Lorraine, already in the feed for how to get the proper testing done. I don't know. I mean, that's the best context I can give you based on the question you asked. I can't answer the question of how can I get a doctor to use your test for genetics. We have a lot of doctors that use our testing service, but if your doctor doesn't understand it, it may not be the right doctor in this situation, right? You want a doctor who understands gluten. You don't want to ask a doctor that doesn't have that expertise to try to figure out how to do the testing that they don't understand. And then if they do it wrong and mislead you, you want a doctor who understands it. Oh, I love this. Don says, with Hashimoto's, after no grain, no pain, and switching out generic levothyroxine to Tirosint, and TSH and T3 and T4 levels are within normal range. Would you consider requesting a reduction in medicine? I would consider the conversation for sure, Dawn, with your doctor, especially if you're having symptoms of too much thyroid. So like what are the symptoms of your thyroid medicine being too high? Typically it's anxiety, restless leg, jumpiness, trouble sleeping, hot flashes, mood swings or irritability, quick to anger. These are some of the common symptoms we see. Heart racing or palpitations can also be a cause of your thyroid medicine, or can your thyroid medicine being too high can be a cause. So, I mean, it's certainly worth a conversation. I would argue, though, to be careful with that. A lot of doctors are really great at prescribing drugs, but not really great at recommending how to get off of them or how to lower the dose or wean off of them. And I would say if you're looking to go from 25 to 12 and a half, that's a 50% reduction. I probably would talk to your doctor about closer to a 10 or a 15% reduction, the smaller dose reduction at first. Just give yourself some time to taper down and see how you do and have it monitored. But that's what I would encourage you to talk with your doctor about. Is carnivore a good diet for endometriosis? I mean, it can be for some, not for everyone. I think carnivore has its place as a diet. I think in some cases, though, people take it too far for too long. We see some of the worst malnutrition in carnivore, just like we see some of the worst malnutrition in vegans. I think we have a spectrum of food that we're designed to eat. And I think there's a lot of rhetoric and dogmatic beliefs around it. And, that's my take. If you want to learn more about my opinion on carnivore, Anna, check out I did a crash course on carnivore. But my experience with endometriosis and other conditions is that carnivore is not always necessary. Carnivore is a gluten-free, grain-free, oxalate-free diet and lectin-free diet. And so in that regard, if a person has any of those problems, carnivore diet kind of is a one size fits all for those things. And so a lot of people feel really, really good going carnivore. But when I say take it too far, I don't mean there's like an inherent danger they're going to die because they took it too far. But what I mean is over time, it doesn't supply adequate nutrition. And I think that a lot of people develop some severity of nutritional deficit, at least in my experience. I know there are people out there that argue against it, and that's fine. Everybody has a unique experience, and I'm not here to say that your experience wasn't yours, or to pass on a dogmatic religious-like belief in something. I think everyone's unique and different, and testing helps to parse that out as best as possible so that you know what the right move to make is for yourself. Is gluten-free okay and grain-free? I'm not sure I understand what you mean, Andrea. Grain-free is a gluten-free diet, but a gluten-free diet is not a grain-free diet. And if you're trying to go truly gluten-free, you need to be grain-free. So that's the best I can put it to you. Let's see. Hi there. I'm an MD. Wonder if no grain protocol helps with long-term debilitating tinnitus. It might. I've seen it help tremendously with tinnitus. I've seen tinnitus go away. I've also seen tinnitus go away after parasitic treatments. So, I mean, tinnitus has more than one cause. I mean, grain can certainly contribute to autoimmune disease of the vestibulocochlear nerve, contributing to tinnitus, but so can other things. So I think, again, there's no such thing as a one diet to rule them all. I think there's merit to a lot of things depending on the person. Is there anything that can be done for tracheal stenosis due to reintubation after an open heart surgery? I've had 20 bronchoscopies and no positive results. I have lupus and GPA and on prednisone. It's a tough one to say for sure. I mean, I would go back and start with, that's damage to your trachea. What do we need to heal from damage? If we just start with that fundamental question, the body needs nutrition. It needs vitamins and minerals. Now, just the nature of the fact that you have GPA and lupus tells me that you're doing some things wrong, because those are autoimmune conditions that are basically diet and lifestyle induced for the most part. I'm not trying to insult you or say you're a bad person because you have those, but that's what autoimmune disease is. It's an overexposure to environmental stimuli that make the immune system lose its capacity to regulate. And if you had, an intubation, you've damaged now the esophagus, and you're in a body that's already having autoimmune reactions. So the potential for that damage to heal and repair is minimized. And the fact that you have autoimmunity probably means you have pretty severe malnutrition. So I would start with one thing. I would start with a good, solid nutritional assessment, vitamin and mineral deficiency testing, to determine whether you're lacking key nutrients that might help your body heal and repair that damage. Why do I have GI problem? Why do I have no gastrointestinal problems from gluten, but have major depression when ingested? There's something called non-celiac gluten sensitivity, Corey. And the irony here is everyone, and I say everyone, it's probably not everyone, but most doctors, in my experience, disregard gluten as a cause for illness unless you have celiac disease. But that's why the term non-celiac gluten sensitivity exists, because some doctors would call it extra-intestinal manifestations of gluten. Extra-intestinal means outside of the intestine. Well, one of the tissues that can be affected by gluten is the brain. The brain depression is neural inflammation. If you have depression, your brain's inflamed. That's what that means. And just because gluten may not be damaging or hurting physically your gut doesn't mean it's not hurting or damaging physically other tissues in your body. And we see this all the time. Gluten can cause arthritis. It can cause nerve damage. It can cause brain damage. It can cause liver damage. Gluten can cause bone loss. Gluten can cause tendinopathies or chronic recurring tendon aches and pains. So there are a number of things that we know gluten can cause that have nothing to do with the intestines at all, as far as direct damage to the intestines. So keep that term in mind. And if you want to go read more about it, go to Gluten-Free Society. We talk a lot about extraintestinal manifestations of gluten sensitivity. Do I know any good doctors in Michigan? Kathy, I'm sorry. I generally don't make referrals. Not because there aren't good doctors in Michigan. I'm sure there are plenty of good doctors in Michigan, but because I used to train doctors. I spent 10 years, a decade of my life hosting doctors and bringing them into my practice and training them. And what we found over time is these doctors would go on and they would take bits and pieces of what they learned. But unfortunately, the stuff that we would teach about gluten, a lot of it they would just dismiss, and then they would be out there in the world, and then I might make a recommendation for somebody to go see that doctor, and then that person would go there, and then that doctor would have an opposite recommendation than what I would have around gluten and diet change. And so I just don't generally make recommendations unless I can personally vet that doctor will have a similar opinion, because I don't want to send you down the wrong rabbit hole. Doctors literally retract away every time I mention mold. Still haven't been able to get toxicity testing. Yeah, they will, Michael. The doctors when it comes to mold, I just somebody came into my office this morning. Young child, mother took the child in to see the pediatrician because there's mold in the neighborhood. There's like 100 homes that have mold in them. These are brand new homes, and so she's concerned about the health implication for her baby. And the pediatrician just wanted to dismiss it and very, very reluctantly did mold allergy testing, which is in my opinion, a total waste of time if you're trying to figure out whether there's mold toxicity. Mold toxicity, mycotoxin toxicity, and mold allergy are not the same thing. Mold allergy, 5% of the population has. Mold toxicity is a very, very different beast, and it's not the same type of tests. You have to do different things to help identify that. And so mold allergy testing was, in my opinion, a waste of that mother's time. But that's the medical community. There's zero training in environmental medicine in medical school. If you go back and watch, I interviewed Dr. Jeanette Hope a couple of weeks ago, who's a medical doctor on the West Coast with a good mold-based practice, environmental medicine practice. And she talked about her training. I point blank asked her, what was your training in environmental medicine and mold? And her answer was none. We didn't get any. And it's still true today. They don't get any environmental or mold training. Is food intolerant testing reliable and helpful to find out food sensitivities? Yeah, it can be. We offer food sensitivity testing direct to folks online at Gluten-Free Society. If you want to go read more about it, you can. Suggestions on how to detox from a stick, a pokey poke. You need NAC. N-acetylcysteine would be, I would be 2 to 3 grams a day of NAC. I would be on something called matrozyme, which is a proteolytic enzyme. I'd be on high dose vitamin C up to 5 grams a day, maybe more, depending on your bowel tolerance. Those are good places to start to just support your body and its ability to recover. I have low blood pressure this morning, was 91/64. I've had rheumatoid arthritis related to Lyme disease, had treatment 2 years ago and better, but still low blood pressure. Is the low blood pressure making you tired or dizzy? Because your blood pressure is not really that much lower than mine. So I would argue, is it low, or is it your norm? 91/64. I mean, maybe it is low for you. Maybe historically it's been higher. But a lot of people with low blood pressure have adrenal fatigue, and so you might have your adrenal glands looked at in depth. You might attempt, some people find with low blood pressure using deglycerinized licorice is very, very helpful to support healthy blood pressure. But talk to your doctor about those things. Are follicle tests where you mail in hair for tests, are they reliable for testing reaction to food? No, not at all. Follicle hair tests are junk, in my opinion. I mean, if you're trying to measure poison toxins in the hair. Like if somebody's being poisoned or toxin, it can be very valuable. But if you're trying to measure food reactions in the hair, give me a break. It's junk science. I don't recommend it. What basic things do you recommend for my 2 conditions? If you're type 2 diabetic and you've got vitiligo, that means you've got autoimmunity, and you need to go no grain, no pain. That's where you start, Olga. Start with no grain, no pain, and monitor your blood sugar, because if you're on medicine, when you go no grain, no pain, your blood sugar is going to drop. It's going to be better controlled. And if you're on medicine, the medicine might become too strong. So you need to work with your doctor to monitor that and make sure that, you don't end up in a hypoglycemic state. I developed guttate psoriasis the year after my husband's sudden death. My medical doc wanted to treat it with antibiotics. Any suggestions? That's it. I mean, you're missing something in that regard. I mean, if you're already grain-free plus, there are a lot of things that you could look for. I would go back to the fundamentals, what I call the 4 fundamentals of autoimmunity. Measure, test, don't guess. Measure for food reactions for you specifically, as opposed to just a generic diet. That's number 1. Number 2, measure for nutritional deficit, vitamin and mineral deficiencies. Number 3, measure for microbial imbalances. I mean, if your GP wants to give you an antibiotic, his suspicion is that your psoriasis is infectious in nature. So get tested, get it measured. Microbial imbalance, microbes can cause problems, can be a trigger. And then the 4th is chemical exposures. What kinds of chemical exposures have you had historically, but also are you potentially having? And if you understand those 4 areas, then you'll be on a better track toward resolving this problem. I mean, and loss of a husband, I can only imagine that level of pain that you suffered through. I mean, stress is no joke either. That kind of stress can really be a major trigger. And so, if you're still, in that stress zone, that it may take some time. So, give your body grace as well. Question on behalf of medical personnel: would it be feasible to get your videos certified or something so people can get CE credits? I do postgraduate training already, Michael. So there are ways to for that already. So these YouTube videos are more for you guys. I have to keep the language less technical, so that we can have a conversation and an understanding. But my medical lectures are a lot more in depth, and those are available when I do teaching. Somebody's asking where you can get No Grain, No Pain audio version, and you can get that on Audible, Amazon. Go to Amazon, Audible, and No Grain, No Pain is there. I love all the synonyms people keep coming up with for the hokey pokey. My daughter contracted it at the age of 29, having the just wondering if there's a correlation because there is no family history. So the answer is yes. There's actually, I did a piece on this on COVID and celiac disease. Let's see if I can pull that up. I'll post a link for you. There's definitely a connection, and a lot of research believe that post-COVID, we're going to see an onslaught, massive influx of new celiac cases. And I would absolutely agree with that. I'll have to do some digging. I wrote that article like a year and a half ago and published it. I can't find it. My assistant's not here today. He'd find it for us. Can autoimmune disorders cause yellow stool, diarrhea, pain in the lower abdomen? Yeah, I mean, if it's an autoimmune inflammatory intestinal disease like celiac disease, where yellow stool is fat malabsorption, Julie. So that's an early sign of celiac. Crohn's and ulcerative colitis or reactive colitis, all autoimmune conditions of the intestines. Okay, we'll take one more. I think we're up. Well, we're 20 minutes past here. Head and body psoriasis. I'm on medicine for tumor removal, pituitary. What do you recommend? That's just too big of a question, Ellen. Too many complications, too much to unpack there. I would recommend that you're eating real food. I would recommend that you're assessing and addressing your nutritional status to give your body everything it needs to repair, and to make sure that you don't minimize any potential risk of returning tumors. Let's see. Where can I purchase meat capsules? If you go to glutenfreesociety.org, Wendy, it's called Warrior Organ Matrix. And if you just look that up, you can find it there. Okay, I think we'll call it today. I appreciate you all tuning in. Make sure you if you're not familiar with our work and you're new to the show today, come visit me at glutenfreesociety.org. You sign up there for our newsletter. I'll send you a bunch of free information on how to navigate diet and lifestyle to overcome autoimmunity and chronic inflammation. In addition, if you're more interested in mold and you want to learn more about mold and autoimmunity, go check out moldjag.com, sign up there. We'll be, like I said, we're launching the biggest mold project known to man this year. So if you want to stay in the know on that, I highly encourage you to go there. Until next Tuesday, we'll see you for another crash course, and the next Thursday at 12:30 for another live Q&A. Take care, and hope you all had a happy Thanksgiving, and we'll see you next week. Bye-bye.